just click on the link then?
You should. It might be weird because it's going into presenter view. If so, I'm right there and I can
Okay,
come up.
perfect.
So
Okay.
our next presenter today is Yessell.
Hi guys, my name's Yessell Nunez. I'm a senior nursing student here in Demarest. So I actually have a lot of experience with pediatrics. I'm fortunate of that. I have 3 years of pediatric care as a tech, and hopefully I'll be starting my new career as a nurse in the pediatric floor. So with my time being on the floor, I have noticed many things that I have questioned myself about. And my PICO question is, using a distraction technique more effective than not using a distraction technique when given a vaccination. And this is not just for vaccinations, it's for any invasive procedure that a kid has to go through for the pain response. Then I have a quick video that I enjoy watching.
Cooper's an amazing 13-year-old, but he struggles every day. He has a rare disease. His body can regulate things like blood pressure.
Sorry. So before this starts, this is Dr. Gerba. I don't know if you guys ever seen this viral video. He's great. His song that he plays through these videos like constantly stay in my head. The technique that he uses with PD patients, it's probably the greatest I've ever seen. And you guys can pick up and tell me what you guys think about his technique in general. So I'm gonna just stop it right there. So you guys can see. What are some things that y'all picked up during this video? Anyone?
The baby didn't cry.
Baby didn't cry. That's a big thing, right? But I don't know if anyone ever paid attention to the parent. The parent was smiling throughout the whole situation. And I think that's a very big important when it comes to the pediatric population, taking the parents into consideration. So going back to my PowerPoint. Okay, so vaccinations, they're diseases that childhood vaccines are meant to prevent are most likely to occur when a child is very young. This is because we're new and our immune response is not up to where it should be. That's when our risks are the greatest. So therefore, vaccinations are started right when you're out of the womb. You know, infant is born, and then 2 vaccinations are given throughout the stages of their life. The issues of vaccinations can be traumatic, anxious event for the children that progress through life, such as being scared of needles. The distraction technique used during vaccinations for pediatric patient could help reduce the pain response, not just for the patient, but the parent and how the parent does as well. And I mean, just like I hit up on the video, the parents play a big crucial role when it comes to pediatric patients. And by this, I mean, many parents, from my experience, when I've seen them come in, they're automatically, no, I don't want needles in my kid. That's what I don't want. But unfortunately, vaccinations are very important. And when it comes to other invasive procedures, they have to be done for kids to know what is currently going on in their system. So I did research on 5 articles. The strengths of all the articles overall included testing multiple distraction methods in 3 phases before, during, and after vaccinations. Some examples of the distractions that were used were DVD, verbal, music, pictures, rocking, toys, videos, and activities prior to the immunization that included parents. So the first article was a double-blinded randomized controlled trial. And this specific article, parents were taught on soothing techniques after the administration of vaccinations by DVD. This is why they did this specifically, because they wanted to see like a basic of what parents do after the vaccination without any knowledge of how to take care of the pediatric patient. The article number 2 was a randomized quasi-randomized controlled trial. So for this one, studies show all 3 of distraction methods could work in distraction from pain in different timeframes for the provided age group. However, they are not certain that it will work for all children. This comes from being a 1-year-old to a 14-year-old. You're not going to use the same type of distraction methods when it comes to those age groups. It's like bubbles with a 14-year-old. They're not going to be fazed by that. Article 3 was a literature review. Video in the background or giving a toy to the pediatric patient to play with versus not using anything at all to see if there was difference. This was only for ages 0 to 3. Handouts were given to provide interventions to parents on staff before and during after the examinations. After administration of the vaccine, the continuation of distraction and rewards of multiple things were done greatly. The focus of the handouts were targeted at techniques which reduce cost efficiently and can adapt to different age groups and effectiveness. Article 4 was a randomized quasi-controlled. Verbal distraction was found to be the best distraction for ages 3 to 7. The limitation on this specific one was because parents wanted to be able to decide if they wanted to use a distraction or not. So at the end, parents did not agree that they were just randomized on a 3-year-old being able to use a distraction or not. Findings showed no benefit, false suggestions for pain for any age group, so that's a good thing. Article 5 was a randomized controlled 3 to 9 blown bubbles and using a pinwheel as a distraction. 3 to 7 was the impact of music distraction with headphones. And with this, the groups consisted of a control group, DVD distraction group, and they also used a spray, which is like I don't want to say numbing spray, but it's like a very cold spray that I guess the kid reacts to more of the cold than the actual sting of the vaccination. Parents also felt more comfortable, like I said, choosing the method. And research suggests that clinically distraction is more helpful in pain control, but rather than choose their own distraction method. So in conclusion to the articles, all of the research articles for the most part show some type of distraction method helps the pediatric patient with pain response. The research also adds to response to anxiety and the parent's perception on their child's pain response. Parents have a lot of input on how their child responds to the pain due to the transference of anxiety from the parent to the child prior to the administration, during the administration, and after the administration. Although pediatric studies need to be done with specific age groups, overall positive feedback to the distractions were recorded. So to answer my question, distraction techniques are obviously a great thing to do for kids. Unfortunately, with pediatric patients, I feel like there's not that much research given because you can't really test the kid. You're testing more the parent. You can't ask a 3-year-old, are you still hurting? Because their mind isn't all that knowledge yet on what is okay. Is there any questions?
Experience with vaccinations on pediatric patients?
So my experience in general has been, at first I don't have kids, so I don't know how it feels to be a parent, but I do know how it feels to witness parents cry when their kid is getting a vaccination or getting IV fluids, if that's what they're needed. It's scary, unfortunately, but it's just something that has to be done. And I mean, I feel like if you're taught how to go about to take care of pediatric patients, the outcome will be better. You won't have to go into rooms and kids are automatically scared of you just initially putting those gloves on. That's what I experience every single time. They think that, oh, this person's a scary person. But I feel like if we had a child specialist, which is something that some hospitals are fortunate to have. It's someone who goes and explains the procedures to kids by using little toys or by using dolls, and they explain literally what's about to go on as if they're their own little person. And I feel like a lot of times we think, oh, they're just a kid, we're just going to do what we have to do to get them through what they have to. But if we were to explain more to a kid about what is going on in words that they can understand, then the trauma after and in the plan of care, then their hospital stay would overall just be better. Anybody else have any questions?